The CDC relaxed mask guidance for about 70% of Americans yesterday, and it has left many folks wondering, could we be to the point of learning to live with the virus long term, similar to the flu or the common cold? Here's our Don White once more with a take from several experts.
The next step is to wait and watch.
That's what Dr. Richard Rothenberg, Regents Professor at GSU School of Public Health, says the medical community will be doing.
There are three words: pandemic, epidemic, and endemic.
Rothenberg says a pandemic is when a disease is spread over several countries or continents, and it affects a large group of people. The World Health Organization declared COVID-19 a global pandemic on March 11th, 2020.
And so when we speak of something as epidemic, we mean that it is on the upswing, and we are experiencing a lot of disease.
An endemic is where many hope COVID-19 is going. It means there's a low level of acceptable disease.
The infection, or whatever it is that we're talking about, is embedded in the population. It's there. And it can take a number of forms. It can just be constant throughout a period of time. It can be in increases that are often seasonal, such as influenza. It can die out and recur.
The WHO weighed in this week, saying it's a gray area where COVID-19 goes from here. Experts have recommendations on what you're encouraged to do once COVID-19 reaches endemic levels.
It seems to me that the answer here is obvious for how to get out of this, to get it to an endemic stage. We can only vaccinate our way out of this pandemic.
Rothenberg says people who are older or who have underlying disease may want to continue masking up.
What we learned in the winter of 2021 was that if you wear masks, and a lot of people did, and they did it for a long period of time, instead of 50,000 flu deaths, there were 200 during that season.
Fayette County Schools announced Wednesday it will treat COVID as an endemic. Those at the CDC encourage those who are more comfortable wearing a mask to continue to do so.